Mental health disorder can be defined as a disruption in an individual cognition, emotional regulation, or behavior. The statistic in Malaysia shows that 4.6% of 16 years old and above are suffering from this disease, and this number has been doubled since 2019, which has shown that Malaysia is facing a long-term disaster in the mental health disorder problem. It can happen due to various reasons such as personal concern, like the workers are facing hardship to pay their commitment, career challenging, and economic burden. We can see that adults in Malaysia are actually facing problems in the office as they need to bear with it because they get commitment to pay every month. So people in the office are actually should create a good environment for their workers, whether they're senior or junior workers, because they must realize that actually mental health disorder is a very concerning matter, and as a person around the office, they must work together to overcome this problem. Some of the workers in Malaysia are being a breadwinner when they are the only person that work in the family, and they must pay all the commitment happen in the family. So that if the environment around the office is unhealthy, this could lead to a bigger mental health disorder such as anxiety, depression, or maybe eating disorder or PTSD, post-traumatic stress disorder. So in the 21st century, people should know that this is not a taboo issue to be discussed for us. A lot of people, from youngsters to the adults, are facing this problem.
The World Health Organization has made a study that globally, about 12 billion of the working days and 1 trillion of the USD dollars of profit has been lost that it contributed to the GDP of the country, where it will be projected until 2020, the cumulative cost will rise until $60 trillion. It will result in a great loss of the productivity that can become a great global economic crisis that cannot be solved easily. This situation happens due to the ignorance of the well-being of the workers by the employers. They're just solely focusing on the profit they can gain. While in Malaysia, the health expenditure was around 14.46 billion, but in reality, the mental health sectors were only able to receive less than 1% of the initial budget, which is around 344.82 million. The ARA Vitality has made a study in 2018. There is an escalating number of the lost working hours within 1 year from 67.2 days until 73.1 days. The employee had to bear the loss around 2.27 million due to the unexpected absence of the working days. The problem within this investing in health sectors has become a problem, which is the risk of the underinvestment has existing in the health sectors, which bring a huge loss to the GDP of the country. The government didn't know that the health of the workers can lead to death around 745,000 due to the long working hours, which happens to stroke and ischemic heart disease to the workers. What the governments and the firms can do is, globally, we investing about $1 can bring about the return about $4. Totally, it will be bring around 399 billion dollars, with increasing in the participation labor force about 5%, with 310 billions of the USD dollars to improving the overall health quality. Well, in Malaysia, the Ministry of the Health has proposed a 15 years healthcare reform to increase the expenditure about 45.3 billion, where the government promoting conduct counseling and the clinical treatment that can reduce absenteeism around 20% to 30%. These actions are very important, which we need to focusing on the well-being of the health to help improve the GDP of the country.
Good day everyone, my name is Turkasri Anaparupa Palani and my metric number is 300060. Now, let's we talk about the microeconomic impacts on firm due to mental health problems. The impact is that it will reduce the productivity, absenteeism and presenteeism, which is workplace stress and mental health issue will lower the employee productivity. WHO in 2022 also reported that 12 million people lost working days due to depression and anxiety, which costing US 1 trillion globally. Not only that, presenteeism, which is employees can come to work but cannot give their full engagement. This happen due to the productivity loss than absenteeism, which is stated by Cooper and Cove in 2020. The overall effect that it will impact the efficiency, which will reduce the efficiency, reduce the quality of work. Now, let's move on with economic cost and case example. There are two type of impact of financial cost on mental health, which is direct and indirect cost and also business benefit. Investing in mental health program costs a lot of money. Not only that, Dior in 2022 mentioned that in UK there is a loss of 25 million, which is up to 25% from 2019 due to mental health problems. So, by investing in mental health programs, we can earn good fortunes. For example, we can gain $5 by spend $1. Not only that, SAP is also now focusing on early support and wellness of this program, and also SAP's 92.8 retention rate shows that these programs help the employees to keep move on. In overall, in general, we could. Now, let's we continue with human capital and competitiveness. Microeconomics point of view is that they are focused on employee welfare and also mental health. Employee well-being is being a key part of a firm's human capital. By ignoring this, we might face a lot of opportunity costs, for example, like lower competitiveness, less profitability, and also less innovation return. By investing in mental health programs, we can gain the employees' loyalty, productivity, and market competitiveness. Hazard in 2018 also mentioned that there are 70 to 90% work stress are happen due to profitability losses. So in overall, we should understand that investment in mental health programs are not the cost. It's to improve for a better profitability.
Okay. Assalamualaikum warahmatullahi wabarakatuh. My name is Nurdaini Mita Asmadi. My matric number is 300164. Okay. I want to present about economic rational and preventive measure. Okay. In order to address work-related stress and mental health issue at the workplace, actually it is not only a social problem, but it also a economic necessity. It is important to sustain the development of Malaysian economy. So, according to WHO, World Health Organization, mental health issues among young workers are increasing. So, uh, poor mental health can cause low productivity, absenteeism, and high turnover rate. So, in terms of that, WHO estimate that poor workplace mental health cost the global economy around 1 trillion USD yearly. And while in Malaysia, poor mental health in the workplace cost the country's economy around 14.46 billion ringgit Malaysia. Okay, next, based on the table, investment in the mental health program will give the high returns. So it is clear that the return on investment (ROI) in workplace mental health programs directly give a positive impact across the different countries. This means that when the companies or the government implement their initiative to allocate funds to employees' well-being, they can expect measurable financial returns. Based on WHO, every $1 invested, it will returns around $4 in productivity and health gains. According to Deloitte, the United Kingdom showed that the organization implementing mental health support program experienced a £5 returns for every £1 invested. Based on the PricewaterhouseCoopers (PwC) also found that Australian companies gain an average ROI of 231 after they introduced stress management initiative. The Organisation for Economic Cooperation and Development also found that the economic costs of mental ill health amount to more than 4% of GDP annually. So, this shows that mental health programs are not only for social benefit, but also for the company's profitability and national productivity. Okay, next, Malaysian government realized that untreated mental health issue will impact on economic and also social welfare. Therefore, investment for mental health welfare into occupational safety policies is essential for long-term economic sustainability. So, investment in mental health program, of course, will give the benefits. So, the benefit that the companies will get from the investment in mental health programs like lower turnover, reduced absenteeism, higher employee engagement and job satisfaction, and lastly, better profitability and long-term sustainability. So, we need to invest to prevent the mental health issue. So, there is some prevention measure. Uh, the first one is implementing a positive work environment because it is more effective and cheaper than treating a serious mental disorders. In addition, investing in mental health programs such as counseling, wellness activity at the workplace, and flexible working hours will also increase labor force participation rates. Furthermore, modern technology also opens up new opportunities to deal with related stress. For example, the use of digital health application uh, or artificial intelligence (AI) as detectors tool and online counseling platform. Uh, this uh, this preventive measure can give psychological support directly to the employees. This approach not only can improve mental health issue, but it also reduce absenteeism and increase productivity.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nasajira binti Muhammad Tafri. My matric number is 29970. So today I would like to talk about my part, which is government organizations responses. So in my part, there are a few things I need to share with you. But before it, I want to tell you that firstly, workplace is increasing in Malaysia and it's affecting employees' mental health. So as I think this more lead to more workers, which is as they always face stress every day at their workplace. So in a long term, they can lead to mental health. There are a few things about mental health, which is such as anxiety. They can easily get burnout. They can easily get depression. So for your information, in Malaysia, this issue brings a very big economic impact to our economy. So in 2018, a mental health related issue cost the economy around RM 14.46 billion ringgit. So as we can see the amount, this is a very huge amount that Malaysia lose. So this lose come from the absenteeism, presenteeism, and high staff turnover. So this is when they feel stressed, they are not go to work, and their presentation in workplace decrease. So this might be can impact the lose. So this a personal issue. This number shows a mental health. It's not only a personal issue, but it's a national and organizational concerns. So let's move to the second one. Let's look how this issue affect the organization. So on average, Malaysian employees lose 67 working days, absenteeism and presenteeism. So this means companies are losing productivity even when employees show up but cannot perform at their best. So this means that for example, if someone got a mental health issue, so she or he needs a good rest, right? So they do not go to work for around 1 week, and maybe it's always become his habit to go not to go to the work. So previously, many companies did not take mental health seriously. However, they now realize that poor mental health well-being leads to a lower performance and affect the company financial stability. So this change is awareness has pushed organization to take action. So before mental health issue become more crisis, mostly companies in Malaysia take very easily about this, and they always give work to their employees without asking is it okay with them or not, and they are very push their work to get to get the benefits from their works. So now let's look at the organization are doing a test to this issue. So organizational efforts to improve employee mental health, there are two. So the first one, As we know, many companies has introduced workplace wellness program, also known as Employee Assistance Program or EAPS. So, for example, this company, like I think for my research, Petronas and Deloitte Malaysia provide counseling service, stress management, workshop, and mental health awareness activities to support their employees. So, this kind of activities can boost their employee energy to work hard and but not to become a burnout. So they can improve their energy, their mood while doing their work. So besides that, many organizations have started using a flexible working arrangement. So this include a hybrid work, flexible working hours, and remote work option. So this practice help employees balance their work and personal life, which reduce burnout and stress. So for example, I think around last 2019, the COVID pandemic accelerated this change and proved that flexibility is effective improving employee well-being. So this means when COVID-19, we can see all activities need to lock down. So even the workers need to work from home. So this incidents shows that flexibility also not bad. Also not give a big difference between work in the workplace or work from home. So let's continue. So how about government initiative to prevent this issue becomes spread? So the government is also playing a major role, I think, in addressing workplace mental health issues. So one of major effect is a national mental health strategic plan 2020 to 2025. So which this program aims to strengthen community-based mental health and service and integrate peer psychological support into workplace. So the government also provide tax incentive to encourage employers to invest in wellness in program. So for example, companies can claim tax deductions for organizing workshops, fitness program, and mindful activities. So this can reduce their operating costs and motivates them to create a healthy workplace. So last but not least, mental health insurance coverage has been expanded under SOCSO and private providers like AIA Malaysia, which now offer I think coverage for therapy and physiological consultation. So I think this can help mental health can make mental health service more accessible and affordable. So last for my part, when I talk about the organization's role and our why this effort is matter. So I want to tell you, by investing in mental well-being, we can reduce a long-term economic loss that causes by mental health problem that I told you before. It's 14.56 if I'm not mistaken billion ringgit. So it's a very huge amount that we can use this amount to our economic activities, that not to these problems. So at the same time, the workforce is more productive, can become more motivated and more committed to their work. So when a healthy workplace is there, so the employers come to work with a happy face, happy mood, good mood, and without can set them, they need to do a lot of things, and it can be a stress for them every day. So overall, these combined efforts from both organization and government have built a more resilient and sustainable workforce. So lastly, this shows Malaysia's strong commitment to improving mental health and ensuring a long-term social and economic stability. Thank you.
In conclusion, I learned that mental health disorder and stress could badly affect individual, society, and the government, as this is a very concerning matter, as it shows that a company and the government itself has lost their human resources due to this disease. We can see that when the workers are facing this kind of mental health disorder, it can give effect to their work performance as they keep absent from work, which gives trouble to their colleague. So actually, to overcome this kind of problem, every parties, including the colleagues at the office, should play their role well in prevent this type of illness happen to their office mate. The colleague especially must prevent to talk about the personal issues such as the family matters, talk bad about the office mate, as they could contribute to the workers' low self-esteem. the officemen actually should support each other as they are working at the same company to get money to pay their commitment every month. The government can help by implementing strict rules to prevent verbal and physical harassment in the office. By implementing new and strict rules, it could help reduce the rate of mental health disorder indirectly.